Hello, Namaskar. I Dr. Rajesh Kumar Sharma, Professor and Head Department of Critical Care Nursing and Coordinator Skill and Simulation Lab of Swami Rama Himalaya University. In this module today we are going to discuss about how to relieve the choking among the children as well as the neonates. So, as you all know that choking is relieving of choking is very important, especially in the kids, neonates and the childrens, because they themselves are not able to do anything. So, we have to identify first the really person or baby or a small neonate is are under the choking. So, if the baby is able to speak, then we have to ask them, are you choking? If the victim notes yes, cannot talk, severe airway obstruction is present, so take steps immediately to relieve the obstruction. Give abdominal thrust to a victim who is standing or sitting, or chest thrust for obese victims. Repeat thrust until effective or the victim becomes unresponsive, or if the person becomes unresponsive, start CPR. The same thing how we have seen, you have seen in the previous module, that relieving of choking among the adults. The same steps will be done for the children also. So, there is no change in that. But when we talk about the relieving of choking infant, especially at the age less than the 1 year, if the victim cannot make any sound or breathe, severe airway obstruction is present over there. Give up to 5 back slaps and up to 5 chest thrusts, and repeat steps to until effective or the victim becomes unresponsive. So, what we can do for the baby, put on the flat surface, give him 5 chest thrust, and if the object is visible, put the finger and remove it. If object is not visible, please do not put your finger, otherwise this object may go depth of the trachea and it may get stuck over there. And second thing, what we can do, we can put a baby on our palm, and on after that from back side we can give the 5 back blows. So, we have to see that if the object is coming out, please let it come out, and if the baby if the object not coming out, baby becomes unresponsive, start CPR immediately and activate the emergency also. So, let us see in the video how to perform this relieving of choking among the neonates. If we find a baby is choking, so in that case we have to first see his mouth. If we see that object is not removable, so in that case we will go for relieving the choking management. So, in that case we have to see that baby should be on the appropriately on our palm like this way. His head should be downwards. You can see these both fingers, it has to be support the head, and we have to hold with these 2 fingers. So, that it should not go slide, it should be downwards, and we have to give 5 chest thrust. So, we have to give these fingers with help of the middle and index finger 5 chest thrusts like that way, 1, 2, 3, 4, 5. If it is coming, then we can remove it. If not coming, again we have to go for now back side, we have to give 5 blows. So, like that way we have to put our hand and fingers. So, it should not cover the face. So, it have to very clear, and we have to put it and back side, and then we have to give, we should ensure that head should be downwards, and we have to give one leg, one hand should be on the side, and the rest of our body part should be on the other side. So, it will be in the center. So, after we have to give 5 back blows, 1, 2, 3, 4, 5. These all the blows should be downwards. If it is not coming, again we have to continue the same process, 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, and after completing at least 5 cycles, if this object come outside, then it is okay. It is not coming, then we have to check it out, or after 5 cycles we have to assess it again whether it is coming out or not coming. If in the meantime, we have to also assess that patient baby also, that the baby is becoming unresponsive or not. If the baby is becoming unresponsive, immediately we have to start the CPR. Okay, you have seen that how to relieve choking among the neonates in our video. So, I hope that you have understood that how we can relieve it, and you will utilize these all the skills in your day to day life, day to day activities. Thank you so much for watching this our module. Namaskar.